Hi guys, once again Ijaz Hidayat is with you with new talk and with new session, and as I'm always covering the medical profession and the new fields, and we try to explore the new fields in medical technology, and so my audience can get awareness and you get some exposure about the new fields in medical technology in a medical field. So today we are lucky, we have one new profession is the cardiovascular technologist. So today we have one of the senior most person whose experience as a cardiovascular technologist. So let me introduce Saber. Saber, please. Saber is one of our senior most cardiovascular technologist, and we try to talk with Saber, and we'll get some information regarding cardiovascular technology. So, Assalamu alaikum, Saber.
Walaikum salam.
How are you? Is
I'm good, yes.
So, Saber, just first of all, as the patron of our talk, please introduce yourself about your profession, about you, and how you come in this profession, and all about it. So, tell me about your.
First of all, I'm very grateful to you, Mr. Ijaz, for this invitation. So, first of all, I want to introduce myself. My name is Sabir Hussain.
Yeah.
I am a cardiovascular technologist in Vassy. Presently, I am working in an international organization. And I have a master's degree in the discipline of cardiovascular sciences. And I have 12 years experience in the relevant field as a cardiovascular technologist in the cath lab.
So it means that the people who get training for as a cardiovascular technologist, they work in the cath lab, am I right? So what is the criteria? So someone who want to become a cardiovascular technologist, what is the criteria, basics criteria to enroll in this degree? And what was the strength life of the period of how many years you have to study in a cardiovascular technology and to become a cardiovascular technologist?
First of all, we need to be FSC in the medical sciences.
So means, sorry I'm interrupting, so the guys FSC means is a similar like internationally the plus 12 in like 12 standards in a science subjects, am I right?
Yes.
So you have to do the 12 standard in a science subjects, and then?
And after that, we have to do the bachelor degree in the discipline of cardiovascular sciences. It will take 4 years.
It will take 4 years.
Yeah, it's a bachelor of honors.
BSc honor or
BSc
bachelor
honors.
degree in medical technology.
In the medical technology, and the field is the cardiovascular sciences. So in the cardiovascular sciences, you will learn cardiac cath lab procedures, echocardiogram, CT angiogram, ETT, ECG, all procedures are including in the cardiovascular sciences. And as well as cardiovascular diseases and sciences, we are learn about the radiation protection in this field. So we need 12 standards. After that, we have to do bachelor degree, 4 years program in the cardiovascular sciences. Then you will become a certified cardiovascular technologist.
So the scope of cardiovascular technology, what is the scope of cardiovascular technology?
It's a very, very big field, and there is a lot of chances to get your goals of life. It's very easy. And if you have a bachelor degree in the cardiovascular sciences, you can go anywhere in the world, and you have because you have a very charming and very attractive field. Because this is my personal experience. Before I was the only medical technician. Someone told me, Sabir, you have to do this cardiovascular technology.
So there is difference between technician and technologist,
Yes,
of course.
yes.
So technician is something like if it is a 1 year, 2 years course.
A technician is only 1 year, 2 years, and a 3 year courses. They are technicians, and the technologist is certified.
This is a light health profession in a serious base where you get a commission, so like as a gazetted officers.
Yes.
In a medical terms,
Of course, because this is a 4 year degree.
Okay.
So after 4 year degree, you are not a technician.
Yeah.
You are the cardiovascular technologist. And in the Europe and in Canada, Europe, UK, New Zealand,
Even Middle East.
Australia, in the Middle East, and they are called cardiac physiologists also.
Cardiac physiologist.
Yeah.
Okay.
In the European side, they call cardiac physiologist, because in the Europe we are doing all procedures like cardiac catheterization
Okay.
and echocardiogram
Okay.
and ETT stress test also,
Oh my.
ECG also. So they will,
Interesting.
yeah. So in the Europe they will call us as a cardiac physiologist.
Physiologist is a good.
Yes.
Yeah.
But in the Middle East and in the Pakistan, in India, they will call us as a cardiovascular technologist.
Technologist is.
So this is a very
So what
different.
is different between, like, as we know, as the there is a cardiologist who do the intervention, what I know. So what is your role? Because as we understanding, if we talk about the cardiologists, and they are the one who do the intervention, they do the PCI. So what is different role, your role as compared to the cardiologist?
Actually, cardiovascular technology plays a very important role during the procedure. Cardiovascular technology is responsible to assist the cardiologist as a second operator. He will assist to delivering the stents, wires, coronary wires, and catheters also. And after that, he is responsible to prepare the final report also.
Oh, okay.
Yes, this is a
Of
big,
the angiogram or
yes,
angiogram.
of the angiogram, pacemakers.
Pacemaker.
Yeah, and also the cardiovascular technologist is responsible for the programming of the pacemakers,
Okay.
to do the echocardiogram independently,
Very nice.
and
yeah.
have to perform transthoracic echocardiogram and
Okay.
ETT stress test independently.
Very
So
nice.
yeah, this is very responsible.
It's challenging job,
Yeah,
even challenging job.
yes.
Yeah, it's not as simple as to just to help and assist. Because you play a very important role in cardiology, I think. So what about this? Is in the cath lab? Have you any role outside the cath lab, or all work is done in a cath lab by the technologist?
Outside also, sometimes we have to go in the wards, because the post procedure, sometimes we put some intra-aortic balloon pump,
Sure.
and sometimes we have some complex cases, we have sheath, like femoral sheath and the radiation, we have to remove that one.
Okay.
And sometimes we have done our pacemakers, permanent pacemakers, so we have to go in the wards to for the programming of the pacemaker, and to check the intra-aortic balloon pump, if there is any error, any problem. So, and we have to go in the ward sometime to remove the femoral sheaths also.
No, very nice, very nice. It's challenging. Also, so Sabir, for my newcomers and for my followers who are just following me through my YouTube channel, as my YouTube channel is especially for the medical professionals. So as a cardiovascular technologist, what is the grades you are getting, like as salary packages, like nationally, internationally, or the European side, the Canadians, whatever you are mentioning? What is your level in the pay scale level?
Pay scale level is very handsome, because I belong to Pakistan. In the Pakistan, when
How
I was
much in
working,
Pakistan you are getting?
I was getting
Don't tell me the money, but just around about. Tell me about in which scale you are.
1,50,000 approximately.
You are getting. It's
Yes.
very handsome.
Yeah, very handsome. And outside the Pakistan, if you have chance to work in the Middle East, then you can earn more than 10 lakhs per month.
More than 10 lakhs.
Yes.
Enough.
If you have chance to work in the Europe side, you can earn more than this.
Even 10,000
Yeah,
rupees.
yeah.
So I think this was a very charming. So guys, so is there any limitation in a cath lab? How many cardiovascular technologists can work in? If you have two cath lab rooms, and how many technologists you can hire to run a cath lab, like in a one hospital, small hospital?
In a small hospital, it depends how many cath labs we have.
For example, you have 3 cath labs.
So, for example, if we have 3 cath labs, we need at least 20 cath lab technologists.
So it's been a huge number can work as a technologist, huh?
Of course, because this is in this field, the cath lab technologist it doesn't work more than 8 hours.
Doesn't move more than 8
Yeah,
hours.
because this is the radiation field also.
Oh.
So-
Did you get? Sorry, I'm interrupting. So it is radiation field, as you mentioned. Did you get any? You are getting any radiation allowance or something? Because this is you are playing with your body. When actually you are getting daily basis, you are getting radiation to your body, which can cause harm to your body. They are covering with you some something like incentives.
Of course, they are giving us special packages
Oh.
for the radiation protection package also. Radiation, and we are getting food, and we are getting milk allowance also, fruits
Very
allowance,
nice, very nice.
and we are getting special allowances.
How about the
More than
females? How about the females?
Females?
Because this is the radiation field. Na?
Yeah, this is very safe. Actually, we are using the lead aprons during the procedures.
What is lead aprons? Good question. What is lead apron?
Lead apron is it's 0.5 mm thickness of the lead apron.
It's like a sheath you're
Yeah.
wearing on your
Yeah.
body.
Yes, this is a protective shield actually.
Okay.
So whenever we are going inside the cath lab for the procedure, so we have to wear it, and it will protect us from the radiation.
So, for example, if someone like a female technologist and she was working as you mentioned, cardiovascular technology in cath lab, and she's pregnant. So, what is your advice? She can go with the lead apron and do the procedure, or she can go for the leave, or she can avoid to go inside the cath lab.
Actually, this is very flexible field. So for the females, if she has a pregnancy positive, so we doesn't allow her to go inside the cath
So
lab.
she can work outside the cath lab. How can?
Yes, she can work outside the
On the monitor
documentation.
documentation.
Yes, she will do the documentation. She will prepare the patient outside the cath lab,
Okay.
and she will prepare the reports. And if she is not willing to do work in the cath lab area, so we can send him in the echo department, in the non-invasive
So
departments also.
it's mean there is two type of department which belong to cardiovascular technology. One is invasive, and other is non-invasive. So invasive mean like a cath lab. So non-invasive mean technology like a ultrasound or doing some ETT test. All this. I'm right?
Yes, you are right, sir. Because invasive is interventional cardiology like cath lab, and the non-invasive is echocardiogram. It's very simple. It's especially for the female. Females love to work in the echo because
Ultrasound and go to ETT and
Yes.
departments.
yes, because it's very easy for them.
So is there any different packages, like for example you choose to go to invasive and someone choose non-invasive, so is there any different in salary package for that or no?
Not too much, because in the cath lab, people like cath lab because there are a lot of allowances in the cath lab, and in the echo department there is less allowances because this is a radiation field. So we have special package for the radiation work. So echocardiogram is very easy to work. It's like ultrasound. So they have not the radiation allowance and the other allowances like food
But for the
allowance.
most the females like one thing more. What I observe here in a cath lab, you have the nurses also in cath lab.
Yes.
What is their role in cath lab?
Actually, there is a big difference in between the nurses and the cath lab technologists. So the nurses, they are the responsible to prepare the patient, administration the medications, and to give and also they are shifting the patient from in and out.
Their role is only for the medications
Yes.
and just taking care of the recovery and transferring to the patients. So okay,
Yes.
what is clear.
Yes.
So guys, see, today we try to explore the profession called a cardiovascular technologist. So cardiovascular, as what I understand from senior most person who is the ECMO technologist, Sabru San. There is a two type of technologists. Well, you can pursue the field after graduating from the respectable university to get after getting your degree in cardiovascular technology. Either you go into invasive like in a cath lab procedures, or either you can join non-invasive like ultrasound, or you can go with the EEG, ECG, and like echo and all these non-invasive procedures. So there's two types. So guys, If you still have any queries, questions related to the echo technologist, please you can just share your questions, so we will try to answer you, and we'll come up with a new talk. And thank you so much, Saber, for giving us such informative information related to field like echo technologist, cardiovascular technologist. And guys, I am personally know Saber Hussain is one of the senior most person, and he knows his job very well. And if you are just trying to search some medical field, if you are interested, so cardiovascular technology is also one of the best field in a medical professions. So you can do, it's not a matter of the male or the females, it is very safe and challenging. Of course it's challenging, but it is like interesting and more like informative professions. So you can earn handsome salary, you can join as a cardiovascular technologist in not in only simply in Pakistan, you can work outside of Pakistan, internationally, nationally. And as what I get it from Sir Saber Hussain, that in a European side, this degree is called as a
cardiac physiologist.
cardiac physiologist. And guys, there is a huge difference between technicians and technologists. Of course, his technologist is like a higher and superior degree, and they are earning very handsome salary. If you are not able to get the admission in, like for example in medicine, MBBS, so the cardiovascular is also one of the attractive and charming professions. So hope you enjoy today's session. Have a nice and good day. Take care. Bye bye.
Okay.